Hey guys, welcome back to the USMLE Cardiology series. We are just on part 2 of the question that we just did. And just to recap, it's essentially a gentleman that came in with acute pericarditis, and we chose echo as our next kind of best step. And really, we're using the echo to look for some pericardial effusion and that sort of thing. And so let's move on to the next question. If you didn't watch the first part, I would certainly watch the first part before you watch this next one. It's kind of going to give it away. So let's go into the next one. So next question, again, management question, which of the following is the most appropriate next step in management? Echo shows a small pericardial effusion with no tamponade. On exam an hour later, the patient's end symptoms and exam are unchanged. Vital signs are within normal limits. Which of the following is the most appropriate next step in management? So this is all just a fancy way of saying, what's the treatment for acute pericarditis? Okay. So treatment for acute pericarditis is fairly simple. You have a few options. It all kind of goes around what the underlying cause of the pericarditis is. So if you suspect that the cause of the pericarditis is a viral infection, and you think this is acute viral pericarditis, well, then your treatment is just anti-inflammatories. Okay, so anti-inflammatories, aspirin, ibuprofen, any of the NSAIDs plus colchicine is generally going to be your answer. Okay. Other kind of underlying causes of acute pericarditis. So if you have someone with terrible renal failure and their BUN is 100 or 120, and you think that elevated BUN and that uremia is causing the pericarditis, well, the treatment would be, treat the underlying cause. Fix their uremia, whether that's dialysis or CRRT, something like that. So kind of fixing the underlying cause is what you would want to go for. But viral pericarditis or idiopathic pericarditis, aspirin, NSAIDs, or colchicine. So here they give us a couple answers that have a little bit of everything. So clopidogrel and aspirin therapy. So aspirin is an NSAID, but clopidogrel, both of these used together is kind of your dual antiplatelet therapy. And so this would be something we would use for a guy who just had an NSTEMI or a STEMI and needs dual antiplatelet therapy. So the aspirin part of this is correct, but both of these together is incorrect. B is the correct answer, ibuprofen and colchicine therapy. It's really just anti-inflammatory effects. Ibuprofen for a week or so, colchicine for a few weeks. And that should kind of help their symptoms. And the idea is just to get the inflammation down. C, oseltamivir and acetaminophen. This is just Tylenol, and this is Tamiflu. And so, if the person is having flu-like symptoms and they test positive for flu, you can certainly treat them with oseltamivir, but that's not really going to help the pericarditis necessarily. Neither is the acetaminophen. Tylenol doesn't really have any anti-inflammatory properties. Next, pericardiocentesis and pericardial biopsy. This is kind of interesting. They're telling you, hey, this guy's got an effusion. Should we do a pericardiocentesis? No, you don't need to do a pericardiocentesis unless this person has a massive effusion and has tamponade physiology, and you're worried that, hey, this guy's going to have cardiac tamponade and have a cardiac arrest and die potentially. So small effusion, I wouldn't do a pericardiocentesis. Giving the anti-inflammatories like ibuprofen and colchicine are going to calm down the inflammation, and that effusion is just going to resorb and kind of go away with time. Okay. E, prednisone and tramadol. This is kind of interesting because prednisone is, also a possible correct answer. So prednisone, obviously, it's anti-inflammatory as well, as all steroids are. Really, the way I think about it is one of the options, but NSAIDs and colchicine are always better. Prednisone is something I think of if my patient cannot tolerate ibuprofen or NSAIDs or colchicine, then I would use prednisone. So if you have a patient that's got terrible renal failure, terrible AKI, and you're afraid of giving something that would cause damage to the kidneys, like an NSAID or colchicine, that's a situation where you can use prednisone. There are some studies and some people that would say that, if someone fails treatment with NSAIDs and colchicine, you can use prednisone kind of as a secondary type measure, which is reasonable, but certainly answer B is the best choice. And tramadol is just like a weak opiate, and certainly you could use that for pain, but it's not really helping with inflammation, so it's not really first line. Yeah, so that's the question. We went over pericarditis. We pretty much diagnosed it using the history, the labs, the EKG, and then what we would do next, and then basics of treatment. So if you guys have any questions, please leave something down in the comments below. If you guys find this helpful, let me know. Would appreciate if you guys subscribed as well. It really helps get these out to as many people as we can, and help some people out. And so thanks so much. See you guys soon.